Hello everyone, in this video we are going to discuss about body water compartments, its clinical significance and some calculations. First, coming to total body weight. So whenever we see a person, the person will have a total body weight. Out of the total body weight, 40% is solid and 60% is fluids in cases of male. And in case of females and in obese patients, the fluid levels will be somewhat less, up to 50%. So we will calculate based on a male. So 40% solids and 60% fluids. So this fluid compartment is again divided into three: intracellular fluid, extracellular fluid. Intracellular fluid is fluid within the cells and extracellular fluid is fluid outside the cells. So it is divided into interstitial fluid and plasma. Interstitial fluid is the fluid between the cells and plasma is in the blood. So intracellular fluid is inside the cells, interstitial fluid is between the cells, and plasma is inside the blood vessels. So it comprises intracellular fluid is two-thirds of total body water, and in extracellular fluid, which is divided into interstitial and plasma, is one-third. Remaining one-third is extracellular fluid. In this extracellular fluid, almost 75% is interstitial fluid and remaining 25% is plasma. So the main ions in the intracellular fluid are potassium, magnesium and phosphate, and in interstitial fluid are sodium, chloride and bicarbonate, and in plasma are sodium, chloride, bicarbonate and proteins. Proteins are absent in interstitial fluid, we should remember this, and the function of intracellular fluid is cellular metabolism and enzyme action, and interstitial fluid is nutrient and waste exchange, and plasma it is useful in transport in the blood. So no blood cells are present in the interstitial fluid, and in plasma also it doesn't contain any blood, but it surrounds the cells. In interstitial fluid there will be blood cells. The pH is 7 in intracellular fluid and 7.4 in plasma and interstitial fluid. So out of total body weight, 60% is water, 2/3 is intracellular fluid, 2/3 of 60% is 40%, and 1/3 is extracellular fluid, 1/3 of 60% is 20%. So out of 20%, 75% is interstitial fluid, that is 3/4 of 20% is 15%, and plasma is 1/4, that is 5%. So 15 plus 5, 20% is ECF and 40% is ICF. So whenever we take a person of 60 kgs, total body weight will be 60%. Total body weight will be 60%. So 60% of 60 kgs is 36 liters. So 36 is the total body water. Out of total body water, 36, 2/3 is ICF, 2/3 of 36 is 24. So 24 liters is ICF, and out of the remaining 12 liters is ECF. So in 12 liters, 3/4 is interstitial fluid. So it is 9 liters, and this remaining 3 liters is plasma. So we can calculate the calculations through this. So why we have to know this body compartments and all is because whenever there is any fluid loss, like whenever there is any dehydration, severe dehydration, there will be loss in the ECF compartment. So in order to compensate it, the fluid from the intracellular fluid will be shifted into the extracellular compartment to maintain the homeostasis. So the water inside the cells will be lost and the cells shrinkage we will see. Same happens in the overhydration. Whenever there is more amount of water in the ECF, the water will be shifted into the ICF. There will be swelling of the cells, and it is if it occurs at the brain level, it is very harmful. So we will calculate based on this. We will see a clinical scenario. A 70 kilogram male patient presents with moderate dehydration due to gastroenteritis. His blood pressure is low, pulse is elevated. Based on the clinical signs, we have to estimate the loss of they have estimated that it is approximately 10% of his ECF. How much fluid we have to replace to correct the dehydration? So we will see it. So 70 kilograms male. So 60% is total body weight. 60% of 70 kilograms is 42 liters. So 42 liters intracellular fluid and extracellular fluid. Intracellular fluid is 2/3 of 42 liters is 28 liters. Then remaining of 14 liters is ECF. So in 14 liters they told that 10% is lost. 10% of 14 liters is 1.4 liters. So we have to replenish 1.4 liters. We have to give in the form of normal saline to replenish and correct the dehydration. So by knowing these body compartments and these values, we can actually treat this dehydration. Same thing in the blood loss. In blood loss there will be loss of plasma, so we can actually use these formulas by calculating the blood loss, and also we can give crystalloids or blood transfusion based on the amount of blood lost. So this is the clinical importance, and these are some calculations.